The Radio Misfits Podcast Network.
Hello, everyone, and welcome to Planted with Sara Payan. I'm Sara Payan, your host, and today on Planted, I'm joined by one of the most respected voices in medical cannabis, Dr. Bonni Goldstein. Dr. Goldstein began her career as a pediatric emergency physician before shifting her focus to cannabinoid medicine over 15 years ago, a move that's helped countless patients and families access life-changing care. She's the author of the widely acclaimed book, Cannabis is Medicine, has been in the forefront of research and patient advocacy, and is known for her deep expertise in the endocannabinoid system and its role in health and healing. Her work bridges science and compassion, from treating children with epilepsy to guiding adults through chronic illness management, always with an eye towards personalized, evidence-based care. Today we'll talk about her journey into cannabis medicine, the science behind the plant, real-world patient stories, and where she sees the future of this field heading. Dr. Goldstein, welcome to Planted.
Thank you for having me, Sara.
Absolutely. I've been meaning to talk to you for a while because we met briefly at Patients Out of Time in 2015, where we were both faculty, and I really enjoyed your talk that year. It was just such a great gathering of like-minded folks.
Yeah, that was a great conference, and I love going to conferences. It's great to meet everybody else that's in the same field, share stories, and obviously network, but also learn about, there's so many different aspects to this world of cannabis that we live in. So it's great when you get to these conferences and you meet people from all the various different approaches, from, the cultivators and the researchers and so on.
Yeah, it's super enlightening, and it's especially back then where there were less people than there are now involved. It was, it's actually kind of a big step for people to go to a conference, step on a stage, and have that conversation. The atmosphere was a lot different than it is today.
That's right. There's so many more states that have medical cannabis available. So many, I just think, the whole paradigm shift just over 10 years. We have so much more information. We have more cannabinoids available to patients to use. And I also look at my approach to patients. What I was doing in 2015 is very different than what I'm doing now for certain conditions. Very similar to what happens in other aspects of medicine, because new products come out, and we have more science to guide us.
Yeah, absolutely. I want to dig into more of that, but before we do that, I'd like to ask you a question I ask all my guests. What was your first cannabis experience?
Well, so apart from what most people experience in college, really, I was in the world of medicine. I had taken a little time off from being a pediatric emergency medicine doctor, a little burned out, and I had a friend who asked me about cannabis. She was suffering with a new diagnosis of cancer, struggling with side effects of the cancer and of the chemo, and she was just miserable. Her husband actually asked me about cannabis and kind of helped her negotiate, and it had opened, this was back in 2008, opened my eyes to it, or maybe 2007. And at the time I was kind of looking for something different to do, and I just thought, wow, this is so interesting from a just purely kind of science geek perspective, like, the compounds in the plant, the endocannabinoid system, which I hadn't learned about in medical school. It was only being discovered the same time I was in medical school. So all of this kind of new science, and it just really excited me. And so I started working in a practice where I met with patients here in California, because we had the law from 1996, and I just fell in love with the practice. The patients were genuine. They were seeking help. They wanted to be part of a legal, safe system. They didn't just want access to cannabis. They wanted access to cannabis that would help them. Because as we know, it's not one size fits all,
True.
right?
Yeah. Yeah, absolutely. I mean, it's such a valuable thing. I know for myself, when I was in my late 30s, I was diagnosed with stage 3 colon cancer. And My mother is retired now, but she was a cancer researcher at the time and a hematology oncology nurse. She did the clinical trials on FOLFOX5, which is what I ended up taking, and it was pretty gnarly. It almost killed me twice. And it was because of her that I ended up getting my medical card. She'll tell you that she didn't tell me to use cannabis. She'll say, no, I said THC is very good for nausea and appetite. But, when you can't have those conversations with your physician, not that it will kill you, but you can make some really uncomfortable mistakes, which is a lot of what I did, because at that time, my oncologist couldn't write my recommendation because the head of his practice would not allow that. So I had to actually coach my one of my specialists to do it for me. And when you're not well, it's like you don't really want to be managing up with your docs.
Right, right. But that's okay. It was there and it helped you.
Yeah, it did. And, not only that, but now when I see my oncologist once a year, she and I have really good conversations about it because, I've done since I've been in the industry for so long. And as an educator, I've worked with a lot of physicians at UCSF and Kaiser doing trainings to have the conversation so that they can talk to their patients, because they say that every time their patient tells them about it, they learn more and they're able to help more people. And I know that a lot of your work is bridging that gap with your colleagues as well and getting that conversation started.
Yeah, that's right. Because so we know that very few medical schools cover the endocannabinoid system,
Mm-hmm.
if at all. Very few internships, residencies discuss the endocannabinoid system. Remember that if we talk about a dysfunction or deficiency in the endocannabinoid system, first you have to know what that system is. But second, if we talk about an imbalance a dysfunction of that system, then you're acknowledging that the answer to that often includes plant cannabinoids. And there are so many um, um, physicians, clinicians, practitioners who are just not up on, which cannabinoid for what condition, how do I dose it, what form should I recommend to my patients? I mean, all of those questions come up. And so it's something that's bothered me since I started doing this in 2008. Like initially, I kind of felt like I didn't even want to tell anybody what I was doing because I would be considered kind of very fringe doctor, which I'm really not at all. I look at the science. I try really hard just to look at the science and use the science to treat patients. Um, and I got so frustrated over the last few years about what my patients report, meaning my neurologist said my child should never use cannabis, even though the child is on 7 different seizure medications and has no quality of life and still having 10 seizures a week. Like it just seems crazy. What you're doing is not working, and there's a potential that this plant can work, but because you don't know about it, your patient doesn't have access. That to me is not okay. And so I created a new company, and I was just telling you about it. It's called Goldstein Wellness. It's for licensed anybody in the United States that has a healthcare license with their state. So an acupuncturist, nurse practitioner, an RN, a physical therapist, anybody, MD, DO, you name it. If you've got that state license, you can sign up for free. It's truly no strings attached. It is kind of, I'm hoping, like, I feel like it's my gift or my legacy to just take what I've learned over the last 17 years and I just created there's like over 30 videos at this point. Um, there's a certificate course for free. There's a forum where you can ask me, hey, Bonni, how would I start dosing such and such, this particular case, where we can share information.
Mm-hmm.
And it's a place truly just for education. And like I look at it this way, if somebody just signs up and they look at 1 or 2 videos a week, within about 2 months, you're going to have a good understanding of what the endocannabinoid system is, how cannabinoids can help treat underlying endocannabinoid system issues, how cannabis can help with chronic pain, and it's all the research. I summarize all the research. I do the deep dive for you so you don't have to go searching through PubMed. It's all there. And so But part of that comes just from my inner science geek, but also I can't treat everybody. I'm just one person. I need my fellow clinicians to start having these conversations with their patients, or at least be able to have the conversation with the patient, and
Yeah.
then get started with that first patient. Hey, I am going to recommend some CBD dominant oil for your anxiety. Let's see what happens together. The one thing I will tell you is that if you're just, you don't have to be as careful as you are with other medications. These compounds are so safe. And I've
Right.
had so many patients overdose by accident and they're fine. So with THC, it can be very unpleasant, but with all those other compounds, you just really don't see too many side effects. And that's the one thing also I'd like to just share, is that when you read through the literature, which I do kind of, again, as a science geek and on a regular basis, what you see, especially in almost every clinical trial using cannabinoids, is you'll see this sentence somewhere in the abstract or at the end of the article in the discussion: safe and well tolerated. We see it over and over. Now, whether or not it reduced the pain in their study is beside the fact. Yes, we may see some benefits. And of course, that all depends on the design of the study. What is the product that they're using? Is it whole plant versus isolate, right? There's so many factors.
Mm-hmm.
Did we recruit the right people? Did we start off with a dose too high? But in general, almost every single study says safe and well tolerated. And I think that's just really important, because unfortunately, doctors and other healthcare practitioners are still taught that cannabis is a drug of abuse and that it's harmful.
Yeah.
And I help literally babies with it. I also help 90-year-olds with it. It is safe and well tolerated.
Yeah. Yeah. I wonder when we're looking at, how medicine is developing. Like I'll preface this with, truly believe in traditional allopathic medicine. I come from a family of healthcare practitioners. Um, but the one thing that I've noticed, one thing that's frustrating, but also is hopeful, is that it seems like for the longest time, a lot of doctors were pushing back as far as integrative medicine. And now it seems like we're seeing more open-minded physicians that are looking at that and maybe even taking more of a critical thought approach versus leaning on basic protocols. Like for myself, when I was sick, I was 37. I was vomiting and I had cramping. I went to go see a gastroenterologist who was like my father's age. Kind of patted me on the head, told me I had IBS, said, I'll see you when you're 50. I'm like, you're going to see me when I'm 40 because my great grandmother died of colon cancer. And then I kept getting sick, and I ended up going to see a physician who was female. And she was like, I hate to ask you this, Sarah, but would you be open to a colonoscopy? I know it sounds weird. And I was like, please. Couldn't get the tumor past, that's the scope past the tumor. And I ended up meeting this gastroenterologist again after my 12 rounds of chemo, my resection of my colon, going in for the follow-up colonoscopy. And I was coming out of recovery, and I asked him to come over, and I let him know what happened. And I said, you told me I had IBS, I had stage 3 colon cancer. Please listen to your patients because they're dying. And his face went white. But I just feel like, we're all human. We're all doing the best that we can. But it seems like in this era, with the way insurance is and the pressure for physicians to see patients, get them out, get a diagnosis, it seems like it's really hard sometimes for physicians to hold the space and look at the deeper picture. And I'm wondering what your thoughts are about that. Give the gift that everyone will remember this holiday season, the 12 J's of Christmas gift box. This limited edition collection features 12 premium pre-rolls from 12 sun-grown farms in Humboldt, Mendocino, and Trinity counties. It's the ultimate gift for craft cannabis lovers and a way to support small farmers in the Emerald Triangle. Hurry, quantities are limited. Reserve yours now at emeraldtrianglecraft.com.
Well, I think that's true. And I think, we also know that sometimes people who are highly, highly specialized don't like being challenged in terms of their knowledge. Could you be wrong? I mean, that's like many clinicians. We do tend to be a group that have been told our whole lives we're smart, and we tend to have egos. But I always go back to kind of, if somebody came to me, how would that look so that I would be open to something? And I think part of it is, hey, doctor, what do you think about medical cannabis? And that's the first question, because that's going to give you a lot of information when you're talking to your doctor. If they say, oh, it's all a hoax,
Mm-hmm.
then you have a decision to make. And that decision is, do I come back the next time with the printed out articles from PubMed and Google Scholar showing that cannabis is there is substantial evidence for its effects with chronic pain, or that nausea, or whatever it is that you're dealing with epilepsy, because we know that there's published data that maybe they have not come across.
Mm-hmm.
And so you can choose that path, or you can say, let me find somebody who's going to be a little more open, because maybe you don't want to fight that battle. If you're sick, I totally get it. You might want to just say, okay, I'm going to find somebody else. I also think that now we have a fair amount of cannabis clinicians available who you can kind of go around your clinician and just say, hey, I need help. Get the help you need, and then kind of tackle that other problem. I don't think it is helpful when somebody finds benefits with cannabis, then and goes to see a clinician and doesn't tell them about it. Your experience matters. Your experience should be is valid and should be validated by that clinician. And if that clinician wants to poo-poo you, then you have a choice. You stay with them or you move on. And I don't think that it's disrespectful to say, doctor, I understand where you're coming from, but I think you need to start looking into this, because I am finding it helpful, and there is scientific data to support that.
Yeah.
And I don't think that's disrespectful. I think that's sharing. If my patient comes to me and tells me about a new treatment, and I get this all the time, especially in pediatric cancer patients, parents will track down some other treatment. They will not take, we got nothing left, right? It's their
Right.
child. And also with epilepsy, I'm going to find an answer for my child's illness. I have a patient in my practice whose mother started a brand new biotech company to treat her own daughter. I mean, parents do not stop, they are unstoppable. And I just think that when a patient presents something to you, you just kind of blowing it off, I don't think that's helpful. I think we as scientists should say, gee, let me write that down and I'll look it up. I mean, it takes 10 minutes to look things up on the internet. And especially if you've been in practice for a long time, you can tease out what's valid and what's not.
Yeah. How, it's one thing to advocate for yourself as an adult. It's another thing being a parent and having a sick child. I know in the past, when I had parents, when I used to work in retail, when I was a head of education for a dispensary chain, we would have parents that would come in, especially during the 215 days, and be looking for something to help their child. And a lot of times there was a heaviness around that, not only because of the stress of what was going on, but also wondering about being judged and just the optics, talking to the physician, talking to their families. What have you seen? How are people navigating this?
Sure. It's a great question. Well, luckily, things have evolved over time, and cannabis is, although there are those who are still all freaked out about children getting cannabis, remember that we don't give insulin to non-diabetics. So we are not handing out cannabis to children who are not chronically unwell, right? The number 1, 2, and 3 conditions I see in my practice in pediatrics is epilepsy, intractable, meaning not responding to other medications, moderate to severe autism, where the behaviors, insomnia, and challenges of that child's autism have become very difficult to manage, and or the school is having a hard time. And then the third condition is advanced cancers, where these children are being told, well, they've gone through the chemo or they've relapsed a second time or a third time, and the parents are now truly desperate to find the answer. So when you think about those three conditions, just from a compassionate standpoint, why wouldn't you try something that is in general very safe and in general very well tolerated? But of course, the goal would be not for a parent to have to negotiate this on their own. One would hope that they could find a clinician like myself, or there's a lot of people now out there. And in fact, Goldstein Wellness, if you're a patient, you can go to goldsteinwellness.com and click on I am a patient, and we can refer you to a clinician. We have 49 out of the 50 states covered with practitioners, and we even have a free and low cost option. Plus we have a ton of other clinicians. So all these clinicians have already signed up and they are willing to help you. And remember, they're getting their education with me, so they understand how to treat children and so on. But I think back, like when you're talking about the 215 days, what we're talking about is Prop 215 way back when, like what we called it the Wild West out here in
Right.
California, right? Where you went into a dispensary and things weren't even labeled, right? I mean, it was like, here's a little cookie. You had no idea how many milligrams were in it.
Yeah.
And if it worked once, there was no guarantee the next time you went and got it that it would work. So I've been there with you through that experience. It's so much better now. And there's a lot of neurologists that, basically because there is also a prescription CBD now, and many neurologists lean towards that. They want you to get standardized medication. And I'm not against that. The whole idea here is you have to have everything on the table for these kids. And I just think, going into a dispensary and asking someone behind the counter, just say, my child has epilepsy. I spend an hour to an hour and a half with my new patients. Why do I do that? Because I'm gathering all this information to basically create a regimen that will work for the family, that will work for the child, and that is very thoughtful and personalized. And I don't think you can do that when you're walking into a dispensary and asking what product. Now, the beauty of cannabis is that product you buy, you may go home and try it and it works. Thank goodness, right? And it's
Right.
not going to harm you. But could we do better? Yes, we can do better with it, at least. And I even tell people, even if you think you know about it, sometimes it's helpful to talk to a practitioner. For instance, let me just give you an example. There is a cannabis compound called cannabidivarin, CBDV. There's some evidence in the literature that it can help with seizure control. There's actually a study from Australia it's only on 5 little girls with a particular syndrome. But I have patients here who have done well on CBD, but let's say have only gotten a partial response and still continue to have lots of seizures. And remember, in children who are developing, seizures can be very damaging to that development. And I know from this study and from my background looking at all the research on CBDV that it has properties as an anticonvulsant. So in some of my patients, after we've trialed CBD, we will start with CBDV in very tiny doses and titrate up. You're not going to find that information in a dispensary,
Right.
right? Because they usually don't carry CBDV. What type of CBDV should you be using? What dose should you be using? This is why you want to have a practitioner.
Yeah, it's so important. I mean, with my staff, I was always very cognizant of making sure that people didn't behave as healthcare providers, but as navigators, so that they could give the information to whoever's coming in a way that they would be able to turn around and talk to their physicians about it and make the decision with them. Because I think it's really important because, like you said, it's not going to kill you, but you could get really uncomfortable, or at the very least, because of how expensive it is nowadays, you waste money.
That's right. And we don't want anybody, I mean, when you think about the time put in, the money put in, the effort put in, again, working with someone who's knowledgeable can absolutely speed that process up.
Yep, absolutely. And For parents and children that you're working with, how do you create that safe container for experimentation for them?
Um, what do you mean by that?
So, as
Experimentation.
we have a baseline on how we see like the majority of human beings responding to different cannabinoid ratios
Mhm.
and terpene profiles. But as you know, there's always going to be anomalies because we're walking chemistry experiments. How do you figure out the ratios and the volume that creates the desired reaction in the
Sure.
body?
Well, you have to start somewhere.
Right.
So it depends on the diagnosis, kind of what I'm going to start with, and also what have they trialed before? What are their other medications that they're on? Are they
Hmm.
sensitive to medications or not? Because I get a lot of what I call unicorns in my practice who are
Hmm.
super sensitive, who literally can take zero point 0.1 ml, that's like 4 drops, and that's too much.
Hmm.
So there are, and there's, what I try to do is treat everybody as an individual. And I always, we have the saying, start low and go slow.
Yep.
Well, if there is a defined dosing, we just start at the lowest end of dosing, see how the patient responds, and then titrate up. I have a saying, and I use it in my book: rule it in or rule it out. So that what that means is you're starting with a product, you're titrating up, and you're looking for the desired effect, or even a partial desired effect is okay.
Hmm.
And if something is helping, whether it's a full response or a partial response, then you're dialing in on the dosing of that product. It is ruled in. If it's not working, oh, it makes me paranoid, or oh, my child's tummy is upset, or whatever, we've ruled it out and we move on to the next one. But we slowly, even if you rule something in, we don't stop there. Then I'll usually add in, depending on if the parents are reporting that there's room for improvement, then I'll add in a second cannabinoid. I have patients that take 4 to 8 different products 3 times a day for their severe epilepsy and autism, who are going to school, they are functioning, they're doing great. Everybody's looking, saying, wow, this is unexpected. We never
Hmm.
thought your child would meet their IEP goals or would be on a track at school to graduate. So I do see a lot of really great success. There's a small percentage of patients that appear to be non-responders. I'd say somewhere about 15 to 20%. But conversely, that means 75 to 80% of patients respond. That's a pretty good number when you're talking about difficult to treat conditions, especially in pediatric patients. Um, and that's kind of the approach. It's there's a lot of back and forth. You have to report back to me what your response or your child's response is, so that then I can determine what's next. Recently I went through something with my mom and her blood pressure medication. So she was on medication for a long time and started to have issues. And turns out that now her kidneys don't like this one particular medication, and we're letting was letting all of her potassium go out of her body, dangerously low potassium. So we had to find new medication. We switched to something else, check the blood pressure, check the labs. Didn't work so great. Now we try again. Now we're on the fourth and it's working. It's very similar. It's the same, it's kind of the same approach. It's just with plant medicine.
Right, right.
Yeah,
Now, how do you set parents up for reporting back? Because one of the things that I've noticed with people is people would come to me and be like, "I'm trying to use cannabis for blah 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 blah, and it's not working." And I would look at him and I'd say, "Well, what happened?" And then they'd be like, "I don't know. All I know is that it's not working." And it seems like in this crazy world that we're in, when we're moving from moment to moment, we lose not only touch with our bodies, but when you're trying to figure out what's going on with your child, it's like, how do you set them up for success with being able to
sure.
report back to you?
Right. Well, so first of all, I check email 1,000 times a day. So that's number one, email.
Mhm.
But also, I try to explain there's three different responses to all medications. One is a good response. It's working. I feel better. It seems like my blood pressure's down, or my child didn't have as many seizures this week, or the school didn't call for me to come pick him up at school because he threw a chair across the room every day this week except today. Right. So there's benchmarks for success, which we talk about when we first meet. Like, what are your goals? If you need your child to sleep through the night rather than get up 17 times, then that's what we're going to focus on. You can't fix everything at once. So we try to figure out, what's the most important thing, one or two things that you want to approach, and we can work on that. And then, we can work on the other things down the line. Two is to manage expectations. So there are reports of patients with that first dose of CBD oil, they don't ever have another seizure. And oh my goodness, I wish everybody had that response, but that's not the way it works. So I think managing expectations is very important. And one of the things I tell all my families is we need at least 3 to 6 months of trial and error to figure out how your child responds to these compounds. I have patients where we've tried CBD dominant oil and they just did not do well. And then we moved to CBG dominant oil and they just did not do well. And then we moved to CBDA and we're starting to see a response. Oh, I think this is working. Is that child now maybe doesn't do well with decarboxylated compounds, maybe only with the raw compounds? Now, I didn't know that. They don't come in with a tag or a manual that says, hey, I'm only going to respond to these. So what I tell people again is that rule it in, rule it out. We're going to start somewhere and we basically kind of work through the different cannabinoids. I have used CBD dominant, low ratio CBD THC, THC dominant, CBDV, CBN, CBG, CBC. I'm missing, CBGA, CBDA. Yeah, I mean, there's so many.
Yeah.
And so what I tell people though is this is a journey, and I'll accompany you on the journey, and we'll figure it out. And like I said, every now and then we get lucky and somebody's a responder right out of the gate. And then, but most of the time, especially because you have to remember, these are kids with complex medical issues. Oftentimes they have more than one, sometimes more than 5 different conditions. Sorry. And it's very difficult, again, to know who's going to respond to what.
Yeah.
And that is the key. My research that I published with a company called Canformatics is a company that created some technology looking at biomarkers in the saliva. And we collected saliva from children who were on cannabis for autism. They were already on it for at least a year, if not longer, but with good success. And again, this was a proof of concept trial. And what we did was we collected the saliva in the morning. They hadn't had any of their cannabis for at least 8 hours, sometimes longer. And we were able to look at their various biomarkers that measure neuronal activity, inflammation, pain levels. And basically, when I talk about biomarkers, it's just a chemical in your body that is part of a pathway that functions in a certain area. So like inflammatory pathways or pain signaling pathways. We were able to collect those compounds through saliva. Then the children got their medical cannabis, and then we collected saliva 1.5 to 2 hours later. Also, the parents did behavioral surveys, meaning how is my child responding? And they had a little survey that they would fill out in the morning before they got their medical cannabis, and then at the same time that they collect, and both times when they collected saliva. So the post cannabis was also after the child got their cannabis, 1.5 to 2 hours later, they collected saliva and did the behavior survey. And really interesting results, better than I could have imagined, which was that we found that if a child had a low level of a certain chemical or compound, which we measure as a biomarker, with cannabis, it rose to be closer to what we would call kind of the normal levels, or what we call the physiologic range. If their level was high, it shifted down, which is one of the first studies, I think we may be the only study that documents what we call the homeostatic properties of cannabis. So remember, if you have hypothyroid, you have low thyroid, you take certain medicine to get it up. If you have high thyroid, you take certain medicine to get it down. They're not the same medicine.
Right.
With cannabis, it helps bring you back into homeostasis or into balance. And so all we can really say, again, because it was a small study, is that in this population of children whose behavior surveys correlated with the response in the biomarkers, meaning shifted towards that physiologic range, we saw incredible improvements. And I will say that not one patient shifted away from the physiologic range. Now, in the beginning of treatment, when we treat somebody, if they have a bad response, we might see that shift away. Remember, our patients or our participants in our study were all those doing well on cannabis. So now we're going to look and see what happens when you start somebody on cannabis in the beginning. Do you see shifts away that correlate to maybe some unwanted side effects of the medicine? And then as you correct, can you go back, right? Can you bring them back around? One of the things about our saliva technology is that when you collect the saliva before somebody's using cannabis, if we can basically, for lack of a better term, like kind of crowdsource all the data, we might be able to have patients in our database that have very similar salivary mapping. And then I have a patient, I say, oh, this other patient is very similar to you physiologically, not just symptoms, but underlying chemical makeup. And we'll start with what worked for them, addressing those pathways. So the whole idea behind this salivary biomarker technology, which is so easy, you send the kit to the family, they spit in the tube and they send it back. I mean, it's super easy. It's not available just yet. We're working on getting it available and getting it out. But then I can understand what I'm missing now, which is what's the underlying chemistry of this human who's asking me for help.
That's
like, how exciting is that to be
That's
able to tell the baseline? Like, and it's very similar again, and again, just as an analogy, if I measure your cholesterol and it's off the charts and I give you a cholesterol medicine, I can bring it down, right?
Mhm.
But we also know that there's lots of different cholesterol medications and some people don't respond well to one or the other, right? And how you respond is based on your physiology. So to have that underlying chemistry or underlying physiologic information will help take away some of that trial and error and get us to the promised land a little quicker.
This episode is brought to you by Fat Nugs Magazine, a global perspective of cannabis and stoner culture as a bridge to the rest of the world. Right now, you can join Fat Nugs Magazine, Beard Bros Farms, Freedom Grow, and Jailed for Weed in the upcoming Prisoners Edition and help spotlight current and past cannabis prisoners and their stories, because no one should be in jail for a plant. Find Fat Nugs Magazine's beautiful print copies at your local dispensary, fatnugsmag.com, and on socials. Cannabis culture welcomes us all. Yeah. Well, and that was so. Once a quarter, I used to do a training with the palliative care pharmacology students at UCSF, and that was one of the biggest questions that they would always ask me. They would say, "Hey, let me give you a scenario. A patient has blah blah blah. They're this. What ratio would you recommend, and how much should I recommend for that?" And I used to tell them, that's not how you work with regular prescriptions. I'm like, what do you do? And they would say, well, we start out at this, level. We do blood testing. We adjust. And I'm like, and I think that having that conversation, especially with the tools that you're talking about, really normalizes that conversation for people and demystifies it so that maybe it's
That's right.
not as scary.
It's measurable.
Yeah.
It's measurable. And I mean, we still have a lot of work to do, and we're hopefully going to be expanding to 150 patients. Our initial study was only 15, but it looks like we're going to be expanding. And I'm really excited about that because when we gather all that data, we're going to be able to just help so many more people. And it's not going to be kind of this mystery, like, is my child going to be a responder? I might be able to tell you right out of the gate, you know what? Your child's biomarkers for all the things that we're looking for are spot on. Cannabis may not be the answer. And think about saving that family money and resources and time and effort. They still might want to try cannabis just to see, but I just think it would be helpful to have some way to be able to measure success. Even though I will tell you, in the medical world, what somebody reports, which is so crazy to say this, is not considered evidence. right? I know
Yeah.
it's not. And I've been told that over and over because of placebo control and the patient knows what they're taking and they want it to work and so on. I always say, if you're doing you think you're better, that's good enough for me. If you
Yeah.
think you're doing better, as long as I'm not witnessing some downside to it. But I think with kids who, for instance, in the autism community, how do you measure if they're getting better? Just because they're sitting still in a chair and they're not fighting with you or they're not creating a disruption in the classroom, is that better? Is that really better? I mean, we can tranquilize kids and have them sit still. That's not hard to do. But
Right.
what we want to do is we want to correct and not balance. We want to get them back into balance. We want to correct any of the imbalances that are going on. And I just think that we can really do a lot better with if we have the proper tools. Right now, look, I've been doing this for a long time without any way to measure other than what the parents are saying. But I will share with you when I have multiple parents who don't know each other sending me pictures of their child in a dentist chair and saying, this is the first time we've been able to go to the dentist without heavy sedation.
Hmm.
To me, that says something about the medication, doesn't it?
Yeah, it
About the child's
absolutely does.
response. How about my child is able to stay at school all day, every day, and I don't get called to pick him up, and I'm not getting called that he's, harming other children or harming himself. Or the teacher came up to me after school and said, "What are you doing? He's different," right? These are all really important things, and I just think it's like I live this every day, and I get kind of annoyed by people who still consider medical cannabis a hoax because that's basically kind of negating not just my experience, but the experience of thousands and thousands of my patients who have found this to be such a useful tool in the toolbox. And I always will say, if you have to pay for medicine out of pocket, if it's not working, you're not going to buy it.
No,
And
you're
so
not.
why do all my families keep month after month, year after year, continue to, and not everybody, many of them. I mean,
Hmm.
again, like I said, there are some people that are non-responders. And of
Right.
course, I will share with you, I'd like to know why. Is it
Yeah.
something we can overcome? Is it a microbiome issue? Is it a medication issue? Is it something else? And so that would be helpful too.
Yeah. Do you find sometimes that it's a mode of use issue?
Um, it can be kind of formulation issue.
Hmm.
So, like olive oil based tincture versus MCT oil based tincture, sometimes extraction. Some of my patients do better on an alcohol extraction than they do on a CO2 extracted product.
Hmm.
There's so many variables, you could go a little crazy trying to sort it all out. But, once you kind of learn the different variables, you kind of cycle through different products to see. As long as a family is willing to try, I'm willing to try along with them. If we get to a point, and I have had this very difficult conversation with some families, like your child's not a responder, and I don't think that there's much more. We've spent 2 years exploring. It's a
Hmm.
long time. It's a lot of money. It's a lot of effort.
Yeah.
It's time to take your resources and try something else. Some of my families who may not see benefits of seizure reduction or improvement in difficult behavior challenges sometimes will continue to just use some CBD dominant oil for neuroprotection and for anti inflammatory purposes, which I think is very reasonable, almost like, making sure your diet is not inflammatory. To me, this is a plant
Hmm.
and we treat it as a medicine, but it's also a plant. And remember, what are we all talking about in terms of health? Phytonutrients, right? All these
Right.
benefits that most people get. Some people can't tolerate plants, but I do think it's um, again, this is why someone should work with a practitioner, is because there's so many different options. And
Yeah.
I've had people come to me who have tried literally 20 different things, but yet they didn't try. It dawns on me, oh, you never tried high dose CBD. Let's try it. And then right out of the gate, we see a response. And so, again, and what's high dose? How is somebody who's not knowledgeable in this,
Right.
how do they know what high dose is?
They don't. They don't.
Yeah.
It's through trial and error. And then even if you're working with a non-euphoric cannabinoid, if you're using more than you need, I mean, at the very least, you're wasting medicine and you're spending more money than you should be. When you're looking at emerging non-euphoric or emerging or minor non-euphoric cannabinoids, are you finding that there are more opportunities to have success stories with your patients, especially in pediatrics?
So in my pediatric practice, I could basically tell you there's nobody who's just on THC alone.
Mhm.
So everybody is on combination. Now, some patients are on high CBD with low THC, some patients on a 1-to-1,
Mhm.
plus some may be on other like CBG, CBDV, CBDA, CBN. It just, again, depends on their response, what we're looking for, the goals of treatment. Um, so I would say in my pediatric practice, which makes up about half of my practice now, most are on, well, and none of them are, nobody's impaired because we just don't see that. And of course, that's not really, in order to get the child out the door to school or to function and to participate, we're just not looking for impairment. In fact, when the parents call me and say it was a little glassy eyed, I'm like, okay, we got to change something, right? And parents know,
Yeah,
they
they do.
absolutely know when their child is glazed over, just like you can tell with anybody in general. Um, but I would say in my adult practice, a lot of people will, if they tell me that it's just not enough. Look at doc, I had to go on an anti-inflammatory, or I had to go on a sleeping pill. Okay, cannabis is not filling that gap. Is it because
Mhm.
we're not on, you've tried everything and it's just not doing that for you? Or is it because we haven't tried other um, products, right? And
Right.
so pretty much for everybody. And I have patients, that just kind of check in every year with me. They want to stay medical. They've got their regimen. They're like, I'm good. I don't need much, but I always try to educate them. Hey, there's new compounds out on the market. Let me just educate you about CBDA. Let me educate you about CBN or whatever,
Mhm.
because they may not have come across it. And so I always try to do a little education every year with all of my patients to open their eyes to what else is available, because we don't all stay the same.
Right.
You can
Right.
get any new medical condition. Insomnia can hit you at any time,
Yeah. Oh,
right?
absolutely.
Arthritis, as we all age, arthritis starts to kick in. And maybe THC just isn't doing the trick. Or you can't take THC during the day because you don't feel that that's the appropriate time for you to take it.
Yeah,
So we have
absolutely.
a lot of other options. Yeah. And I think part of what my job is as a practitioner is to just say, hey, we have these, the plant gives us not just THC and CBD, but this whole slew of compounds, which are now available and may do the trick for you.
Now, as we're wrapping up, and Bonnie, I have loved our conversation today. We have so much more to talk about, so I would love to have you back another
I'll
time.
be more than happy to join you.
But as we're wrapping up, what would be your biggest advice to parents that are considering cannabinoid therapy for their children?
Sure. So the first thing I'd say is I do have some YouTube videos out. They're free. Go check them out. I also have some articles out there. So if you just Google my name, you'll see some articles. But then what I would say is now I can only take care of people in California, and currently right now I have a waiting list, so I really can't take on anybody new right at the moment. But Goldstein Wellness can, if you go to goldsteinwellness.com and register as a patient, you can register yourself. And you don't have to put your child's name in just for privacy purposes. You could
Mhm.
register yourself and then look and see. And we have free and low cost options of somebody who just will talk with you to give you the information. Here, look at this article. I'm going to email you all the latest information on epilepsy or autism or chronic pain or whatever, about CBD, about THC, about whatever it is that you're curious about, so that you can at least gather that data. It's funny, in when you have a medical issue, sometimes you just go in and the doctor is the one that gives you all that education. But with cannabis, it seems like you do have to do a little legwork ahead of time.
Mhm.
And I will tell you that legwork will pay off, so that when you have the conversation with the practitioner, you're going to understand what they're talking about. And
Yeah.
so I just think it's really important. One other thing is, if the child has cancer, there's a wonderful nonprofit called Max Love Project that I did a series of videos for, to explain cannabis just from A to Z. If your child has advanced cancer and you're curious about cannabis being part of their regimen, or to help them with side effects and so on, if you register with Max Love Project, again, it's a free, you have to join their website, and then you can watch those videos. But it really is just some basic information. What's in the plant? What's the endocannabinoid system? What does the research show for cannabis and cancer? What does the research show for cannabis and chemotherapy, radiation, immunotherapy? These are all very important topics if you're going to explore cannabis.
Thank you so much, Bonni. This has been wonderful. For
It's
those,
my pleasure.
yeah, for those of you listening, if you're looking for information, please check out her website. Follow Dr. Goldstein on social media. This has just
Oh,
been
and
a
my
great.
book.
Yes,
My
and your
book
book.
is written to be, I've been accused that it's not sciencey enough and that it's also too sciencey. So I think I walked the right path, and I
Yes.
made it so that most people can understand it. You don't have to have a science degree. And it does breaks down the endocannabinoid system, the plant, and some of the cannabinoids. The book was written in 2020, and believe it or not, it needs to be rewritten because there's so much more information.
And what the name of the book?
Cannabis is medicine.
Thank you so much. Thank you, Dr. Bonni. Please come back. I would love to dig into some more with you, especially giving our listeners some more information about the endocannabinoid system.
Happy to join you.
Thank you. Thank you so much. I've got to run to my next meeting, but
I'm
I would love
sorry
to.
about all the ding dongs. My husband is texting me. He's buying medicine for a friend of ours with cancer. So
No
he's
worries.
asking me a million questions because he doesn't know anything. He didn't read my book.
you
Okay.
you're gonna make him do it. But seriously, I'd love to have you back. And just so you know,
Yeah, just reach out.
yeah,
Yeah.
the excerpt from there's going to be an excerpt from this in Fat Nugs Magazine for the Cannabis and
Okay.
Children issue. So I'll keep you in the loop for that too.
Please. I'd love to share that with everybody, my followers and everybody.
Will do.
Okay, Sarah, you're lovely. Thank you so much.
Thank you so much. It was a pleasure.
Delight. Okay, take
Take
care.
care.
Bye-bye.
Bye.
And I'm glad you kicked cancer's butt. Bye-bye.
Thank you. Bye. And everyone, remember, if you like listening, please give us a review, share it with a friend. Let us know what your favorite episodes are. And if you'd like to stay in touch over social media, we are Planted with Sara Payan on Facebook and Planted with Sara on Instagram and Twitter. You can also go to our website, www.plantedwithsara.com, or listen to us on our parent network, Radio Misfits Network, where there are other great podcasts, like one of my favorites, the Winemakers Podcast. So check it out. You can listen to Planted wherever you listen to your favorite podcasts, whether that's Pandora, Spotify, Amazon, Google, Apple, Stitcher, tune in. We are there. So join us. And until next time, stay curious, stay safe, and remember, it's a wild world out there. Be good to one another. Until next time, take care.